Today on Dr. Osborne's Zone, we're going to talk about a nutrient that has been shown to help people overcome addiction, infertility problems, blood pressure problems, and so much more. This nutrient is one of the least discussed but most powerful arsenals in my supplement closet in my practice. You're not going to want to miss this episode. We'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's Zone. Welcome back. Today we're going to discuss NAC, N-acetyl cysteine. Now, what is NAC? We've heard about it. It's been buzzing about the media as of late. NAC is a supplement, although it's also a drug. So we know that the FDA has approved NAC as a drug to treat different types of situations, one of them being acetaminophen overdose or Tylenol damage to the liver. So it's classified technically as a drug, and the WHO considers NAC an essential drug. But if you live in the US or Canada or Australia, NAC is actually an over-the-counter supplement. So what exactly is NAC? NAC is a precursor to the amino acid called cysteine. So there's N-acetyl cysteine, and then there's cysteine. And NAC as a supplement is actually much better absorbed and better tolerated orally when people take oral doses. And so it's just better to use if you're trying to get more cysteine through supplementation. It's better for you to use N-acetyl cysteine than, say, L-cysteine, which would be an over-the-counter available amino acid. So again, NAC is a precursor to the amino acid cysteine. Remember, amino acids are the building blocks to proteins. So all the proteins that your body puts together are derived predominantly from amino acids. And cysteine is one of the what is considered non-essential amino acids, but meaning your body can make cysteine. It actually produces cysteine from another amino acid called methionine. But there are certain circumstances where your body can't make enough. Right? And so those types of situations, those circumstances, are what we've referred to as conditional, right? So conditionally essential is oftentimes the way you'll see that written. So we know that, again, that cysteine is a conditionally essential amino acid that when certain situations exist, the body cannot produce enough of it from methionine. And so getting more either through diet or through supplementation becomes necessary. An example of that would be trauma or injury or surgery. This is a situation where the body, in order to heal or repair from the damage, will require more cysteine to do that work. So again, we're talking about NAC. NAC is a supplement, also classified as a drug. We use it very, very commonly for a number of situations, which we'll talk about shortly, but it is the supplement that is the precursor to the amino acid cysteine. Okay. So let's talk about some of the key functions of NAC. These are just some of the things that we are fairly certain NAC is responsible for or can help us do. One of the things is that it can help chelate metals. So it binds toxic metal, things like aluminum and mercury and lead, and it can help expel those from the body. So it's oftentimes used in a number of ways medicinally as a metal chelator or a metal binder. It also produces glutathione. Now, glutathione, many of you have heard of this. This is the most powerful antioxidant in the body. It helps the liver take out the trash, so to speak. So when a person has low glutathione, they're susceptible to a host of different types of problems, including liver damage, especially if they do things like take prescription medications or drink alcohol regularly that are metabolized by the liver. And so those things can deplete glutathione. Well, cysteine, N-acetylcysteine specifically helps to generate or to build or make or produce glutathione. Now, N-acetylcysteine, through the production of glutathione, has a very, very powerful antioxidant action as well, but it also has an anti-inflammatory action, so it can help with inflammation. If you missed my show last week on the immune system, you can check that out because we talked a lot about cysteine, N-acetyl cysteine specifically being used. A number of studies coming out of, you go to the WHO's website, a number of studies showing that N-acetyl cysteine actually acts as an anti-inflammatory for people that have COVID or people that get sick with colds and flus. We also know that it's a mucolytic. What does that mean? That means it breaks up mucus. Now, what else is floating around in the news these days is the fact that a lot of these over-the-counter cough medicines designed to help bring relief to people with colds and flus for the past 30 years, and they're now saying they didn't work. They never worked. They actually are ineffective. And so, you know, instead of buying something like that over the counter, you might look at supplementation with N-acetyl cysteine for its powerful mucolytic abilities. So if you've got a cold or a flu and you've got a lot of congestion in your chest and a lot of mucus buildup, maybe in the sinuses, N-acetyl cysteine very, very effective at helping with that. So if we look at, you know, what some of the research reviews have to say on N-acetyl cysteine, we'll blow this diagram up for you, but this was published in the journal Antioxidants, and so you can find this on the National Institute of Health's website. But direct antioxidant action. So we know that NAC has an actual antioxidant component itself beyond just working as producing glutathione. So we know that NAC makes glutathione, which is an antioxidant, but we also know that NAC has direct antioxidant function. In some conditions, it acts as an antioxidant for oxidant species. So again, helps to protect your body from free radical damage. We know that it has a chelating action, and this is what I was referring to earlier. Chelating basically refers to the binding of transition metal or heavy toxic metals. Again, so it binds to those and it helps those be more readily excreted by the body. We know that it has an indirect antioxidant action, so direct function but also indirect, in that it helps producing glutathione, and that's what this is referring to here. We also know that it has an anti-inflammatory action. The mechanism is that NAC suppresses NF-kappa B activation and subsequent cytokine production. So if you've heard that term cytokine, these are little chemicals secreted by white blood cells that can induce inflammation, chemicals like TNF-alpha, tumor necrosis factor alpha. We know that it has a mucolytic response. It breaks down disulfide bonds. We don't need to talk about the chemistry, but basically what that does is it allows it to break up mucus. And so these are, again, in summary, some of the main functions of N-acetyl cysteine when taken. And there are different routes of excretion, or routes rather of administration. And we'll talk more about this, but there's oral, intravenous, and then there's inhalation mechanisms. And we'll get into some of the dosing that if you're thinking about using NAC as a supplement, we'll get into some of the ways that it's administered here shortly. Now, something else I want to get into, some of the other effects that NAC can have. Let's blow this image up for you. So you look here, we've got, I said earlier that we can take NAC and it's a precursor to cysteine. And I told you earlier as well that methionine, the amino acid methionine, can also be consumed, and that also helps get to cysteine. And then from there, we have all these other types of functions that different research studies have shown to be outcomes of using NAC. One is to lower oxidative stress. Well, this is what we were referring to as an antioxidant. Antioxidants, kind of the easiest way to think about an antioxidant without all the chemistry is antioxidants help us age gracefully. Some people talk about anti-aging medicine. You hear a lot about that, in like different magazines or different press where they're trying to sell products for vanity reasons, but there's really no such thing as anti-aging, but there is such a thing as graceful aging. We don't want to age at an accelerated pace. Antioxidants help ensure that that doesn't happen. We also know that cysteine improves insulin resistance. So there's a component, and I'll show you some research studies here in a minute on how it actually can help to do that, but it helps insulin work better. And remember that when your insulin doesn't work, this is the outcome of this can be diabetes or blood sugar problems. Now this can also lead to what are called AGEs. You see this term AGE, small letter S. That stands for advanced glycation end products. What AGEs are basically they're damaged proteins, and the reason they're damaged is because of sugar. Again, we're talking about diabetes here. So the diabetes, the excessive glucose as a result of insulin resistance, leads to the formation of more of these AGEs, and these AGEs accelerate the aging process. That's why the acronym is AGE, right? And so these AGEs have been linked to a number of different types of inflammatory disorders and dementia. So again, we know that cysteine can help lower AGEs. It helps to control them. We know it also improves the bioavailability of NO, nitric oxide. Nitric oxide is a very, very powerful biomolecule. In part, what it does is it helps to regulate blood pressure, which we'll talk about here in just a minute. And so we also know it modulates other vasoactive systems, as well as it helps or improves individuals with renal dysfunction. There are a number of studies that have shown people with chronic kidney disease, actually there's some improvement parameters that are shown when people are taking N-acetylcysteine. So again, if you've got insulin resistance, if you've got renal or chronic kidney disease, if you've got blood pressure problems, this might be something you want to talk with your doctor about, is talking to them about whether or not N-acetylcysteine is right for them. We could say it like that, as so many commercials do. This study is a review on the effect of cysteine on blood pressure. And so if you look here at table 4, this is a list of human trials. So these are human studies. There are a number of animal studies that show the same thing, but I wanted to give you a resource that shows you actual human studies where when the N-acetylcysteine was given in the doses and the effects or impacts on blood pressure. So you can see in this first trial of humans, we had 1.2 grams a day of N-acetylcysteine for 1 week, right? So this is a relatively small dose. It's a relatively small period of time, just a week. And what they found was reductions in systolic blood pressure and diastolic blood pressure. And so, again, systolic is the top number. When the doctor's taking your blood pressure, if you're not familiar, it's that top number, and the diastolic is that bottom number. So again, if you're taking your blood pressure, just understanding what that means. But again, this N-acetylcysteine in this trial reduced both of them, the top number and the bottom number. Remember, systolic is the pressure on your vessels when your heart is beating. Diastolic is the pressure on your vessels when your heart is at rest. So again, that's why that difference, that's why that bottom number is typically much lower. But again, it reduced both. In this other study, they used 1.8 grams a day orally of NAC, and this study was done only for 3 weeks. Again, very short studies, and what they saw within 24 hours is a reduction of systolic and diastolic blood pressure. And then this next study here, you can see 1.2 grams of NAC given a day. They also in this study used arginine. Arginine is a precursor to nitric oxide, so that's one of the reasons why they were combining or using arginine in that study. They were trying to get a bigger impact or an effect on nitric oxide. Remember, the better, more efficient your body is capable of making nitric oxide, the more resilient and elastic your blood vessels are. So that's why it helps with blood pressure. When your blood vessels are stiff, pressure goes up. But when you produce adequate nitric oxide, again, arginine, L-arginine being a precursor for that, it allows for better vasodilation, vasoconstriction. So they combined the two, and they did this dosing structure for 6 months. What did they find over a 6-month period of time? Reduction of systolic and diastolic blood pressure, but also mean arterial blood pressure. So human trials using N-acetylcysteine. If you've got high blood pressure, again, you might just want to talk to your doctor whether or not NAC is right for you. Now, there's other reasons that a person might want to consider supplementing with N-acetylcysteine. Again, depending on where you live, maybe some of you are watching from countries where NAC is considered a drug. That's where you can talk to your doctor about a prescription, but several different things here. So one would be an acetaminophen overdose. This is why the FDA has approved NAC as a drug. It is to treat acetaminophen. This is, Tylenol overdose. How many of you pop Tylenol on a regular basis? As a matter of fact, one of the drugs that we know, or one of the things that we know depletes glutathione and cysteine, N-acetylcysteine, is regular use of Tylenol. Not even necessarily overdosing. It's because the liver has to process that drug, and in order to process it, it's using cysteine to do that. We also know that cold and flus, upper respiratory infections, that cysteine, N-acetylcysteine, there are a number of human trials that have shown benefits in that regard. We also see it with bronchitis and asthma. Again, there are a lot of reasons why a person might have asthma or might have bronchitis. Smoking inhalation, gluten exposure, other food allergies, environmental allergens, etc. But NAC can be used as a mucolytic, and this is where it helps to alleviate some of the breathing pressure. And then we also have research studies on PCOS, polycystic ovarian syndrome. You remember I showed you a moment ago how NAC helps with insulin sensitivity, and this is one of the reasons why it helps PCOS, because in essence PCOS is a form of diabetes. Basically it's diabetes of the ovaries. And if your doctor never told you that, ladies, and you're being treated for infertility, you might want to look at looking at the gluten-free diet and looking at a lower carbohydrate, higher fat, closer to keto type diet to overcome that blood sugar problem. We see this a lot. There are a lot of times where women are infertile because of PCOS, and when they dial their diet in, so that diet change alleviates the PCOS because, again, it's a form of diabetes. We see that women with bacterial vaginosis, there have been some studies that show that when women have a history of bacterial vaginosis and then they're about to give or deliver birth, there's some problems with the delivery. And so in these women, OB-GYN doctors in some research studies are giving these women N-acetylcysteine to offset the complications of delivery. We also see the same thing in women with a history of preterm births. If you've had, maybe ladies, if you've had 2 children and you're pregnant, you're about to have a third, and both of your deliveries were preterm, there's now evidence showing that using N-acetylcysteine during pregnancy actually helps diminish the risks associated with that preterm delivery. We see it being used in ulcerative colitis. I'll show you some research on that in a moment, as well as liver cancer and exercise muscle performance. And then there's also new evidence coming out on the nervous system and how N-acetylcysteine helps to block the damage that can be done, the free radical damage that can be done to nerve cells in patients with Alzheimer's or Parkinson's. And then there's also research on male fertility problems. As a matter of fact, let's dive into some of this research. Shrink that down, and we'll pull these studies up for you. Okay, so this first one here, N-acetylcysteine supplementation on sperm quality, chromatin integrity, and level of oxidative stress in infertile men, as I was just talking about, right? And so in this study, in this human trial, right, so we had 50 infertile men. They received 600 milligrams a day of NAC. So this is just for a 3-month stint. And what they found as an outcome was after NAC treatment, these patients' sperm count and their motility increased significantly. So sperm count, that's obvious, the quantity of sperm these men are making. But motility has to do with how well their sperm are capable of swimming upstream. So again, if a man has adequate sperm count but has poor motility, it reduces the chances of impregnating his wife. So again, NAC treatment significantly improved both of those parameters. So conclusion here, NAC oral supplementation can improve sperm parameters and oxidative antioxidant status in infertile males. So I say that because so much of the time, women are blamed on the infertility issues, and it's not all the time. If you've seen an infertility doctor and you have a good one, he's going to look at both the husband and the wife and rule out the different variable potentials. But a lot of times women get blamed, but it's not always the woman that's responsible for the infertility issue. In this one, we didn't talk about yet, but this is a meta review on major clinical trials that were done using N-acetylcysteine as a treatment to reduce or to improve outcomes in people trying to overcome addiction. And so there's a lot of data on NAC in people that have drug addictions, whether those drugs be pharmaceuticals that were prescribed, or also in many cases drugs that are illegal types of drugs like cocaine But we've seen studies on N-acetyl cysteine being effective for alcohol addiction, for marijuana addiction, for methamphetamine addiction, as well as pain medication addictions. And so this is just, again, a meta-analysis of multiple trials. And so a total of 16 trials here were analyzed, and some of the outcome conclusions. NAC provides certain noticeable benefits in attenuating substance craving and might help alleviate depressive symptoms and withdrawal syndrome, because a lot of the reason why people are addicted is they try to get off and then the withdrawals keep bringing them back. So NAC being very, very beneficial in that regard. So if you're struggling or battling drug addiction or illicit substance addiction, you might also consider looking into NAC as a tool to help you overcome those problems. Now here's another review paper, and so this one was reviewing multiple different mechanisms, but we'll just go through a few of these. Liver cancer. So in this, you see here, NAC is an enhancer of glutathione biosynthesis. Remember, that's the antioxidant. Is one of the frequently used antioxidant drugs for treatment of liver disorders. Cell culture and animal models have shown that NAC can preserve normal cells against the toxicity of radiation therapy, radiotherapy, and chemotherapy. Administration of NAC may play a role in the treatment of some forms of cancer, while induced damages in DNA can be completely blocked by NAC. So it protects your DNA and it protects your liver. Key things, key aspects, especially, again, when that's where the cancer is. Also protects you from chemo and radiative damage. Ulcerative colitis. You can see here, NAC may not only protect against the direct detrimental impacts of oxidants, but also advantageously modify inflammation events in colitis. So if you're dealing with a inflammatory bowel disease like colitis, there are other forms of inflammatory bowel disease as well, you might consider NAC. You see the beneficial influences of NAC were related to the changes, including, number one, softened colonic injury or less injury. Number two, decreased oxidative stress. And number three, lowered cell apoptosis. In other words, preserving the integrity and the lifespan of cells in the colon. And then increased recovery of the injured colon. And then number five, increased formation of tight junctions. Remember tight junctions? I'm sure you probably heard that somewhere. If you've ever heard that term, leaky gut. What prevents leaky gut is when you have intact, tight junctions. If those are not intact, then your poop leaks into your bloodstream and creates all kinds of nefarious systemic inflammation that can become very, very problematic. We don't want leaky gut. It's a driver of autoimmune disease. You can also see in this review, we talked about this earlier, but in addition, acetaminophen toxicity is a common cause of drug-induced liver damage in children and adults. NAC has been used for several decades, and it has been proven as a counter-poison choice in treating acetaminophen-induced hepatotoxicity. So again, all great functions to consider talking to your doctor about with NAC. Let's talk about a few more. There's a few more studies I pulled for you today on other beneficial effects of NAC. And this one's in exercise performance. So some of you may be looking to incorporate exercise back into your life. I know a lot of you listening to this are struggling maybe historically with years of autoimmune disease or years of chronic fatigue or illness or muscle pains and aches, and you've tried exercising but you don't tolerate exercise. Well, this is for you. This is also for those of you who are athletes and trying to improve or enhance your performance. As a potential possibility, consider NAC. You can see here they investigated whether N-acetyl cysteine supplementation would enhance exercise performance by increasing glutathione concentrations and by reducing oxidative stress. And they did this study on individuals who had low levels of glutathione. So that was the indicator here is if somebody had low resting levels of glutathione, NAC was tremendously beneficial. Now, if they had normal levels of glutathione, taking more NAC didn't do much. So if you're considering this for exercise, you might also consider getting your levels of glutathione tested. This is a simple test that can be performed by nutritionally trained doctors. Now you can see here the individuals were supplemented with NAC. The dosing structure here was 2 times 600 milligrams twice a day. So for 30 days. So this basically, it's 2,400 milligrams a day in divided doses, so 1,200 times 2, right? And this was done for 30 days. So this is just done for a month. And so they found the low glutathione group improved after NAC supplementation in their VO2 max time trial. You see down here, individuals with low glutathione levels were linked with decreased physical performance, increased oxidative stress, and impaired redox metabolism of erythrocytes, meaning their blood vessels having low levels of glutathione. It impaired their ability to exercise. It impaired their delivery of oxygen. Remember, exercise is oxygen dependent, at least aggressive exercise. So NAC supplementation restored both performance and redox homeostasis. Again, if your glutathione levels are low and you're trying to exercise, NAC can enhance your performance and as well your recovery. So one more reason to consider using it. Let's talk about one more research study here. And this is on NAC's performance for the skin. So you can see here, this is a review, a major review of multiple studies published in the Journal of Clinical and Aesthetic Dermatology. This is, again, something you can find at the National Institute of Health. We've got here, in their results, they found in their review of multiple clinical studies in humans that acne vulgaris, or acne, was improved as a result of using NAC. So they found, the investigators observed significant superiority results among patients treated with NAC compared with the placebo group in reduction of comedone counts, which is acne, suggesting NAC might be an effective treatment option for mild to moderate acne vulgaris. Now, important to note, this study was done using topical cream NAC. So this was not done using an oral supplement. This was actually done using a topical application. So if you're struggling with acne, one of the more common treatments today that doctors give for acne is a synthetic form of vitamin A called Accutane. In my opinion, a very, very high side effect profile type medication that, if I had a daughter with acne, there's no way I would want to put her on it. This might be a better option. Talk to your dermatologist whether or not NAC is right for your acne. Okay, moving on. Let's talk about how a person can end up with low cysteine in the first place. So one would be the chronic use of the pain medicine acetaminophen. This is going to deplete glutathione, which is going to tax cysteine, because again, cysteine being a key ingredient for the production of that very, very key liver detoxification agent. So if you have aches and pains and you're chronically popping, not Advil, but Tylenol or other acetaminophen type medications, you might want to consider supplementing as well with N-acetylcysteine. If you eat a low protein diet, we see this frequently in people, especially in the elderly. They've been told, protein's been so demonized in our culture, and so many people have been told that protein is the bane of illness and causes heart disease and cancer and everything else. But low protein diets are actually very dangerous. And we know this from a number of the studies done in third world countries where low protein is the standard. It's very, very common for low protein diets. And these individuals are rife with infectious disease problems and growth problems and delayed growth and immune system problems. But we know low protein diets, you need, largely you need protein. This is where cysteine comes from. There are animal sources, rather plant-based sources of cysteine, and we can talk about some of those, but low protein is really going to crush your ability to get enough. And then high sugar diets. As I mentioned earlier, we said that N-acetylcysteine had an effect on insulin's effectiveness, and high amounts of sugar are going to tax the cysteine status. And that's what, again, we want to try to avoid that. Additionally, high sugar diets typically are low protein diets. They're also typically low nutritionally dense diets. So they're high calorie diets without very many nutrients. We know gluten consumption, and so in this regard, I see this all the time. NAC, not so much NAC, but cysteine, because we measure cysteine in everyone. It's one of the more common deficiencies that we'll see in people who are gluten sensitive, but the malabsorption in the GI tract, right? So people have damage and inflammation in their GI tract that leads to a malabsorption conundrum, and that can lead to reduced ability or capacity to actually get access to the cysteine from the food a person's eating. So malnutrition from gluten consumption in people with gluten issues. And then unhealthy lifestyle choices as a whole, what is that? That's a lot of alcohol consumption, because that's one of the other things. Remember, alcohol is processed by the liver just like acetaminophen. We see this also in people that have polypharmacy. So maybe you've gone to your doctor, maybe you have 4 or 5 doctors or specialists, and one doctor's giving you 1 or 2 medications. Maybe you're a cardiologist, has you on a blood pressure medicine, and has you on a cholesterol medicine, and has you on a blood sugar medicine, and then your skin doctor maybe has you on a topical steroid type of cream, and then maybe you also have like an endocrinologist and you're on a thyroid medicine. Well, all that adds up, right? And remember, where most drugs are metabolized, it happens in the liver. And what does the liver need to metabolize those drugs? It needs cysteine. Why? Because it's again, glutathione is what we're trying to get to. And if you have a proclivity toward taking a high amount of medicines, drinking alcohol on a relatively regular basis, right, with many of these other unhealthy choices, then you're going to be dramatically depleting this over time, and that's going to predispose you to all the things that we've been talking about. So if you're doing these things, if this is you, you might consider looking at having your antioxidant levels, specifically your cysteine levels, measured, and consider supplementation. Okay, let's talk about food sources, some of the best food sources for cysteine in the diet. And you'll notice that the vast majority of them are meats. And that's not to say that everything is meat, but because you get some from broccoli, you can get some from almonds and split peas. So if you're on a plant-based diet, you do have some options, and those are good ones. There's actually in sunflower seeds as well. We just didn't put it on our diagram here, but sunflower seeds can also provide a good source of cysteine. But everything else, and the highest levels actually don't come from those plant-based sources, really. The highest levels come from meats. And so you can see here, I pulled this from the literature for you. You can see here lamb and chicken and pork and beef. You look at these are milligram amounts per serving. You can see the serving sizes over here. Generally, these are 3 ounce or so servings, but 400, anywhere from meat is anywhere from, upper 300s to 400s milligrams per 3 ounce serving. And then you get down here and you look at, almonds, an ounce of almonds, 133. So not quite as robust. A cup of split peas, 249. Now, if you do eat soy is actually quite high in cysteine. And so I'm not opposed to somebody eating soy per se, but my experience clinically in people that eat a lot of soy, soy is very rich in phytates and other plant-based chemicals that can hinder digestion. And so even though it has a lot of cysteine in it, soy can be very detrimental to the GI tract, creating a lot of malabsorption problems for many folks, especially those of you that have a gluten issue. So I would just caution you about soy. And if you are on a plant-based diet and you are using soy, I would really just caution you to avoid any kind of soy that isn't 100% organic, because soy is in the U.S. is probably the most sprayed crop. I mean, it's double doused with glyphosate, and so you would want to avoid getting exposure to that, because that can wreck your GI tract and disrupt your microbiome in a big way. So again, meat's going to be a better option. And again, the rules on meat, and some of you maybe watching your plant-based diets will get mad at me for talking and promoting more of the meat, but when I say meat, I mean grass-fed, free-range, organic, wild-caught. I don't mean the traditional tract farms where they're mass-producing meat and giving these animals all kinds of genetically modified grains and confining them in pens and just treating them poorly. That's not the meat I'm talking about. I'm talking about high-quality meat. So high-quality meat's your best source of cysteine in the diet. You can get some of it through some vegetables, and if you of course, if you do eat soy, eat it organically. Now, let's talk about dosing around NAC, how to take NAC. So maybe you've watched this and maybe you're thinking, okay, I have several of these problems. Maybe I'm going to see if NAC is right for me and maybe give it a try. Now, there are several things that you will want to understand. So the first thing you want to understand is when we're talking about how to take NAC, the best way to take it, in a perfect world, you take it on an empty stomach, because you'll get better absorption that way. Now, you will still get good absorption if you take it with food, But if you can tolerate it on an empty stomach, take it on an empty stomach. Now, some people find with NAC that if they try to take it on an empty stomach, it can cause some stomach upset and nausea. And that's why I put a star here. You know, some people want to do things perfectly right. Don't think of it as doing it perfectly right. Think of it as take it how you can tolerate it. If you can take it on an empty stomach, do. If you can't, that's fine as well. Prevent that nausea, because it doesn't serve you to pop these pills and be nauseous all day long. So we're talking about oral dosing here. Now, what is the dosing structure around NAC in the medical research? So all those different diseases and all those different symptoms and other issues that we talked about today, the general dosing structure is anywhere from 500 to 2,500 milligrams per day. That's a pretty wide range, and I would say most people do really, really well on 1,000 to 1,500. And when I say really, really well, that means they tolerate it extremely well. And this, again, this is milligram dosing. Tolerate it really well with little or no side effects at all, other than beneficial ones. And it's really inexpensive to stay here. Now you can get, you know, not, if cost is not an option, you know, you can go higher, certainly people do. But you know, this is really affordable for most folks. And if you stay in that range, it's very, very tolerable. And most of the research studies are generally anywhere from 600 to 1,200 milligram dosing structures. And the safety profile, again, is really, really great. There are studies that take use of NAC out over many months. And there are really not any known in humans major toxicity levels if you stick to it around this level. Even if you go as high as 2,500, most people will be pretty safe. Although I would make sure that you're being monitored if you go above 1,500 for long periods of time. You definitely want to make sure you're monitoring it and you understand. The toxicity doses, most of those were carried out in animals. And you know, most of the toxicity doses are several hundred milligrams per kilogram of body weight. So we would be talking about over 10,000 milligrams a day of dosing. You know, again, if you're trying to use animals as a comparative to humans. And so that, you know, for most people, that's not a super practical thing. When you're buying NAC over the counter, again, if you live in the US or Australia, you know, NAC is usually going to come in 500 milligram capsules. And so, you know, again, you know, it's 2 to 3 caps a day. Best on an empty stomach, maybe with food if it creates any at all nausea. One of the things I will also mention is if you go higher than this, what you want to really be cautious about, if you are if you have a bad lifestyle, if you do a lot of alcohol, if you have a lot of processed food that's coming through, some people actually have what's called a Herxheimer effect, because their choices are so poor, their liver is struggling to such a great degree. Taking higher levels of NAC can actually engage the detoxification system, and so they're starting to detox at a much more rapid pace, and that can just cause some symptoms. Low-grade fever, malaise, fatigue, agitation, irritability, mood swings are very common symptoms. So if that's happening to you, you might just consider looking at your diet and your lifestyle a little bit more carefully, but also you might consider lowering your dose. Additionally, where we'll see higher doses of NAC be problematic for a person is if they're in a moldy environment. So if you have a mold infestation in your home, and you're trying to ramp up your detoxification, that sometimes can make you go backwards. So again, many of you I know are chronically struggling, and you're watching this video because you're trying to figure things out nutritionally. But if you react really poorly to NAC, you might consider there's a possibility that you could be in mold as well. Now, so these are, again, oral doses. I showed you this slide earlier. There are more than one way to take NAC, but oral is the easiest way because you can get it over the counter. It doesn't require prescription, again, if you live in the US or the UK or Australia. But there's also intravenous, which would require a prescription, and there's inhalation through nebulizers, which also requires a prescription. So if you're interested in taking NAC through IV, or if you're interested in taking it through a nebulizer, you, again, talk to your doctor and see if NAC is right for you. And I would encourage any of you listening to this, go back to those symptoms, go back to those illnesses that we talked about. If you're dealing with those or struggling with those, NAC might be a really, really good option for you to jump on board with. NAC is one of my favorite supplements for so many reasons. It's so versatile and it's so supportive, and the side effect profile is almost non-existent, and you can really get the doses up there. Plus, it's really super inexpensive to purchase. So pound for pound, it's one of my favorite. It's one of the top nutrients I keep in my nutritional medicinal cabinet, both at home but also in my practice. We pull NAC out on a daily basis. So I hope this crash course on NAC was helpful for you. If it was, drop me a comment below. Let me know what you enjoyed most. If I taught you something you didn't know, chime in and talk to me about it. So thanks again for tuning in. We'll see you next time on Dr. Osborne Zone. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.